everybody. Thank you so much for joining in. My name is Alessandro Ciari. I come from the CUNY Graduate School of Public Health and Health Policy at the CUNY Center for Systems and Community Design, one of the many think tanks centers of the CUNY School of Public Health. And thank you so much for joining us for the Systems Change Lecture Series, which is co-hosted by the Center for Systems and Community Design and the NYU-CUNY Prevention Research Center. We're very lucky to have Dr. Cole Hooley today with us from Brigham Young University. Today, and our team from the CSCD, we have myself, Alessandro Ciari, Assistant Director, who, I'll be around if you need anything technically. I'll be in the chat. You feel free to send in any questions that we have during the lecture. We have Lisa Hitch here, who is our community manager, and also feel free to send questions to Lisa if you have any, and please feel free to ask questions just to all of us. And just a few reminders here, just please put yourself on mute when you're called upon. And also feel free to turn on your camera and join in virtually. We're all here, and hopefully you don't need to be wearing a mask anymore if you're around some other people. It's great to see some faces again. So thank you again for joining us, and I'll be passing it on to Dr. Terry Huang, who is the director of the Center for Systems and Community Design, the director of the Health Policy and Management track of the CUNY School of Public Health, also the co-director of the NYU-CUNY PRC, and the founder of Firefly Innovations. Thank you so much all again for joining. Dr. Terry Huang.
Hey, thank you, Alessandro, and thanks everyone for joining us today. So for those of you who may be new to our lecture series, CSCD is really focused on innovative strategies, developing and testing innovative strategies for systems change. We cut across many different topical areas. And as Alessandro pointed out, one of the new strategies that we are experimenting with is entrepreneurship. And as a result of that, we launched Firefly Innovations about 18 months ago, which is our public health entrepreneurship platform housed at the school. To our knowledge, it's the and only such platforms housed in the School of Public Health. And we've been doing some amazing things, really fun things through the entrepreneurship platform. We have a summer accelerator coming up. If you don't know about it, please do check out our website, firefly-innovations.com. And the Summer Accelerator, which we run annually, is focused on health equity. We usually work with around 8 to 10 ventures and try to help them further refine their solutions addressing some aspect of health equity and get them closer to the market for scale up. So PRC, if you are new again to our area of work, is a shared organization funded by the CDC, so shared between NYU School of Medicine and the CUNY School of Public Health. It has a long history of focusing on health disparity issues with a particular eye towards innovative strategies for community clinical linkages. So you can already tell kind of the undercurrent that cuts across all of our work is really about creating transformative systems change. This year, as part of the Systems Change Lecture Series, we decided to focus our efforts around a theme that sits at the intersection of system science, implementation science, and human and community-centered design in the hopes of allowing for the emergence of potentially a new framework that integrates all of these different areas into a unified model. And so we've been featuring speakers from different fields, different perspectives, all cutting into this problem set from slightly different angles. So today we're really fortunate to be able to have Dr. Hooley with us, who is going to cut into this problem set from the perspective of scale up and sustainability. Dr. Hooley is a social worker by training. He is currently on the faculty at the School of Social Work at Brigham Young University. His research program focuses on how to get what works to everyone who needs it more quickly, more equitably, and more sustainably. His work also brings together ideas from mental health services research, implementation science, system science, and entrepreneurship. You can see now why we invited him to do the presentation today. His research interests were born from his nearly 15 years of social work practice. Over that time, he's served in many different roles out in the field, and he continues to maintain a clinical and consultation practice in addition to his academic and research work. So without further ado, Cole, we're so thrilled that we're finally able to get you to do this presentation for us after a very challenging year indeed. And we're just so thrilled to have you with us, and we're excited to hear about your latest thinking on the subject matter. So thank you, Cole.
Thank you so much. We were just talking at the kind of before the meeting began about how big it's a huge time warp. It felt like we were just talking about this, but that was like a year ago. And then all of our lives changed, and with spring comes some thawing. So it's kind of nice to circle back. Let me share my screen with everyone. Double check to make sure it's showing. Lisa, is that okay? Okay, awesome. Perfect. Thank you, Terry, for the introduction. I'm so excited seeing all of the conversations that the center's having. It's really excellent, just in all of the different angles. And I feel like there's going to be so much innovation from it, bringing them all. So today, as Terry mentioned, I'll be going over some of our work. And I'm presenting it to you in the spirit of this is like an work in progress. And so just as much as I'm looking forward to your questions, I'm also looking forward to your feedback and any sort of ideas or suggestions that you would have to help us move this work forward. I would also say I'm coming with a certain I'm going to open up this as well and move it over here. 1 second. I was going to say, with the question and answer in the chat, would love to see questions there. I'm also coming with a certain assumption of a working knowledge in system science. And so there are many times if I'm using terms that you don't have much of a background in system science to in chat as well, and I'll try to keep my eye on that so that I can slow down even in those moments and explain myself a little bit better, so all be on the same page. So with the presentation for today, I want to first point out my collaborators. Fortunately, Mia is able to join us, so she's in the crowd. Dr. Marsal, she is traveling right now. But wanted to point out these excellent collaborators. Dr. Marsal, she is at UNLV, and she has an expertise in system science, particularly as it applies to helping families involved in the homeless shelter system or who are impacted by housing insecurity and have mental health or other service needs, and has used system dynamics methods, simulations, group model building, a number of methods within that science to answer great questions. And then Mia is finishing her PhD at Washington University in the Brown School, and is similarly doing some thinking on implementation work in team science and also system science, and those sort of approaches to answer these bigger questions. So I wanted to highlight my colleagues before we got started. So for today, my goals are simple and pretty straightforward. I want to spend time describing our process, our method, just because we're finding within the system science literature as it applies to these health service questions, sometimes journal restrictions, page limits, word limits, they don't offer as many opportunities to delve into the steps like this is what we're doing, but venues like this do give us that sort of opportunity. So we want to spend some time talking about sort of the behind the scenes, what we actually did to get where we are, and as well to benefit from your wisdom on how you've perhaps approached some of these questions. We'll share our preliminary model, some of our initial thinking, the current draft that it's in. Like I said, looking forward to hearing other people's ideas on that, and then explain where we're going next. So my substantive area is in the mental health services space. And so today I'll be couching my work in that substantive area, though certainly the methods and ways that we've been applying it could be used in different substantive areas with other public health conditions or concerns. So in a year, well, in the most recent data that we have, there were almost 52 million adults with a diagnosable mental illness. And of those adults with a mental illness, 55% did not receive care. So we have about 45% of those with a mental illness did receive some care, but the majority did not. But if we were to even, there's lots of reasons why people don't get care. Some of them are service related, access, cost, et cetera. But sometimes it is more client or patient related, where they don't think they need care, they don't want care, they prefer to get it help other ways. And so to even slice this more finely, among the adults who had a diagnosable condition and also acknowledged that they had an unmet need. So these are individuals who needed the help and then said, yes, I do need help. So we're bringing it from that larger pool that may have needed help, but perhaps didn't want it or didn't acknowledge it, to the group of people who said, yeah, I acknowledge that I do need some help. And that even if I did get something, it wasn't enough. I still have some concerns. Based off of that group of people, there were about 44% of those did not receive care, of that much more focused group. And just to put a more finer point on it, that the number of people in that group, when you take states like the one that I'm residing in now, Utah, and some of our neighboring states, Idaho and Wyoming, there were more people who had a diagnosable mental health condition and that knowledge that they wanted and needed help and did not get it than the combined total population of all of these states. So understandably, and this is not like a new phenomenon within the mental health services space. This has unfortunately been going on now for decades. So it's not surprising that there have been multiple calls from researchers and funding institutions and providers and mental health advocate organizations saying that we need to scale up mental health services. To sort of anchor ourselves in what I mean when I'm saying scale up, given that it's used in so many different ways, I want to share this definition, this conceptual definition from the National Institute of Mental Health, where scale up is the intentional efforts to maximize the positive impact of mental health interventions successfully tested in experimental studies in order to benefit mental health care at the national level or at a regional level within a country, and to foster evidence-based mental health policy and program development on a lasting basis. CGIAR, it's kind of a mouthful, they had a very succinct definition that they promoted about 20 years ago that I like. For them, scale up is getting more quality benefits to more people over a wider geographical area more quickly, more equitably, and more lastingly. And that tends to be one of the ways that I try to describe the aims of my research program. So here are some conceptual definitions of scale up and how I'm using it. Operationally speaking, though, scale up, there are a number of ways that we can operationalize this term. I'm going to show three key sort of outcomes and how we're operationalizing them in our work. The first is contact coverage. And so from like a public health perspective, this would be the proportion of a target population who receive a service. So proportion of target population served, where the denominator would be the population who this service is intended for, and then the numerator are those who receive it. We want more, though, than people just getting a service. We want people to get better. And so effective coverage is another outcome that is important for scale up. It is the proportion of the target population. So once again, that same denominator. But this time, the numerator is not just those who received the service, but who got better, who improved. And then the third is equity. So not only do we want people to get a service that they needed, we want them to get better, and we want to ensure that our public health efforts are equitably distributed among the population, among the target population. So these are three outcomes that we are particularly interested in our work as far as operationalizing scale-up. So then what drives scale-up? So if these are sort of operationalized outcomes for scale-up, what are some of the things that are driving it? At least within the mental health services space, doing studies on scale-up, using that as an outcome with empirical sort of predictors, it's quite lean. But fortunately, the broader health services literature and in other substantive areas, there are some answers to that question. For our work, because we're coming from a place of trying to apply this, of course, to our space of mental health services, but to see if it's broadly usable across other health service areas, we decided to go back and look at the theoretical frameworks about the concepts, those drivers that they're purporting. So what you're seeing right now, this is the ExpandNet framework developed by the World Health Organization. And here, I'll show you with this laser pointer. What you're seeing here, as far as domains that have influence on scale up, there are external environment characteristics, there are the certain characteristics of the innovation and who the helpers are and the strategies they deploy to help ultimately the adopters and the end users. And within that strategy, they look at these different areas of the strategies, the dissemination and advocacy, organizational processes, cost, resource mobilization, monitoring, and evaluation as all part of the bundle. So this is one way that the WHO are looking at scale up and what are some domains that would influence that outcome. Here is a framework put out by Hooley and Lin. So of course, there's some overlap that you'll see as we go through some of these where you have the innovation and then you have a vision for how large you want it to go. And in order to get there, there has to be some hospitable soil for that to be planted in the fiscal, financial, institutional policy and other spaces. And then there are drivers that can keep it moving forward. And then along the way, of course, keeping track of how things are going using monitoring and evaluation. Barker and their team with their framework for going to full scale have certain things like leadership, communication, social networks, culture of urgency and persistent systems, data systems, infrastructure. These are components here that they have posited that influence scale up. Trish Greenhall and her group, they did a seminal paper for implementation science, developing an adoption framework. This is aptly titled Beyond Adoption, and this is one of their more recent frameworks. And similarly, there are some overlaps with the previous, but here they also are bringing to the forefront the nature of the condition. And this particular framework is specific to technology and using those tools. So they have the different facets and dimensions of technology in those interventions and the supply and demand side of the environment. And then Reese and his colleagues took the re-aim and added some other dimensions, collaboration, co-benefits, systems thinking, and some contextual variables that influence scale up. Guyen brought in some additional constructs, putting them in a phasic model, but then also just giving us some drivers. And then Walters and colleagues brought together a series of papers actually that outline a variety of different components that lead to success. And Curry, they, as you see here, they're dabbling in this sort of nonlinearity of interrelated actions in their aided model. So, I mean, these are just a smattering, certainly not exhaustive of the scale-up framework literature, but this is some conceptual ideas of what would be influencing a scale-up outcome. So some of our earlier work was looking at bringing all of these constructs into domains. It was looking at all these frameworks and putting them into these conceptual buckets. But for the purposes of all of those frameworks and what you're seeing, I don't know, particularly those that might have a systems background, they're super helpful and they're pointing out some key domains that we should be tending to and focused on, which are great. But they're not lending themselves to feedback and the complexity and the interrelatedness of those constructs. So here's some of our early work, also very linear in a way. And so the purpose of that I'll be sharing with you right now will be to take this, advance this in our eyes using a system science approach so that we can create from these frameworks a feedback-based scale-up framework that's tending or trying to broach this idea of like, you have these constructs that all seem to be driving scale up, but how are they influencing each other? And what sort of behavioral patterns might they be creating? So this is the land that we are venturing into. So there are two main components of this project. The first is that we needed to bring together the playground of constructs, sort of populate our sample of constructs and their relationships with each other if they're outlined in the literature, and then build up our CLD. So first I want to talk about the search process that we did to bring together the constructs, and then I'll walk you through how we started building a causal loop diagram. And then at the end of the talk, I'll show you the beginnings of a simulation model that we're working on. So there are lots of different review methodologies out there. I wanted to spend a little bit more time describing ours just because our approach, many might not be familiar with it. If I were to say we did a systematic review or a scoping review or perhaps a narrative review, that might feel much more familiar to many. But we used a hermeneutic review. And the reason why is because it so nicely aligns with the aim of our study. It's a good approach to use when you have a very complex construct that you're studying that is used in a variety of different ways in the literature, such that even finding the articles can be challenging, and scale up is definitely in that space. Even just the notion of scale up, that word, some people are using the term dissemination to speak to scale up. Some people use rollout or institutionalization, scale out, upscaling. There's just all sort of ways that it's being referred to. And oftentimes we found that sometimes they'd be talking about it in a scale up way, but when we looked at their operational and conceptual definitions, it wasn't, or there were times they weren't using those sort of terms and they were doing work that was scale up related. And so this particular process is iterative and flexible enough for complexity. So just to walk you through, there are two main cycles of that process. There's a search and acquisition phase, and then there's an analysis and interpretation phase. And for all those systems people, you can see there's a lot of arrows pointing to each other, allowing for that sort of flexibility. Some of this is pretty straightforward. You come up with a search strategy. You initially narrow that using a sorting criteria, like beginning with reviews, for example, or seminal papers. From that list, you will select articles, actually acquire them, get the text, do an orientational reading of the article, which will then help you identify other terms, perhaps other constructs or utilizations of words or phrases, which will refine the strategy, and then you can do another search. So the search and acquisition phase works like that, but also from that orientational reading, you begin to map and classify the information that you're getting. So for us, we were interested in the drivers, these sort of constructs that influence scale up and their relationship with each other, between each other, among each other. So that's what we were mapping and trying to classify. And once you've mapped it, then you look at, you've mapped and begin a critical assessment of the body of that literature, identifying potential areas of gaps or strengths that helps you build your overall argument for what's needed to move forward. And then that leads to your sort of final product. But as you can see, there's also these other opportunities that by reading, it might open up a different question that you hadn't imagined, and you can go back to a cycle of search and acquisition. So anyway, I just wanted to point out this approach because it's been so helpful for us when we were grappling with the best methods. Question, we're like, oh man, there's so many great review methods out there, but ours is so kind of messy. And how do we account for that and do it in a rigorous way? This is what we did. So now I'll kind of walk through and share exactly how we apply our question mark to our aim. So our searching and sorting process, pretty straightforward. Here are the databases that we began with. And we started out using, I've been doing some scale up work for a number of years. And so I have a bank of terms that I've found and discovered that people have used. So we started with those terms. We combined that with framework terms because we were looking at the broader frameworks. And then using that sorting principle in a hermeneutic review, we also wanted to look at reviews. So there are a number of reviews out there that have looked at scale up, either empirical literature or scale up frameworks, and synthesized it in a way that's bringing all the pieces together. So we wanted to favor those papers. And then we also brought in papers that were just bringing out different frameworks from like empirical research as well. Then when it came to the selecting and acquiring phase, one of us on our team went through and did an initial pass to give like an up vote, down vote as far as whether or not we needed to acquire the full text and look at it more closely. Then a second person went through the exclusion pile to make sure we didn't let something slip through that shouldn't have, and then we discussed it among ourselves if it so happened that someone thought we should keep something. And we erred on the side of being quite generous so that we wouldn't miss out on papers. Then as we were reading through and mapping these, we were looking hyper-focused on the constructs within these frameworks or the constructs of drivers to scale up. Oftentimes, if they had a figure like the ones that I was showing you, we could isolate the key constructs and then look in the narrative of the paper to see how they're defining it. Other times, there are some papers that don't have like a figure, so we would look at headings or within text if they had indicated a particular construct using italics or bold. We would try to find the ones that they have identified as being most important. Then interestingly, there wasn't a lot of, in these frameworks, there would be often an acknowledgement that what they're describing isn't linear and that it isn't so stepwise, but it wouldn't go into detail to say or postulate what the relationships are or how it wasn't linear. And so we found in the discussion sections, actually, that's where many times we would find some of that those musings to say, oh, maybe this is what's going on. So oftentimes we would, in our coding, we would look at that section of the paper as well. We pulled out all the key constructs from the frameworks and then engaged in a thematic analysis of those. And so for me, what that means is I'm a very visual person, and those who've ever done like group model building exercises with folk, this will probably feel very familiar with Post-it notes kind of everywhere. But we took the constructs and we just printed them out and spread them all out. And we started to do an initial pass where first we wanted to start identifying things that we could consider stocks, eventual stocks in a simulation model. So these would be constructs that could have an accumulation within them. So they weren't more just arterial constructs or notions, but something that we could operationalize and measure and see that it could accumulate or deplete. So we started looking at those things and put those into categories. And then we started to go through the constructs and just started putting them in common areas. And so we just went through a series of consolidation steps to arrive at the sort of most parsimonious level of constructs. And we put them into 4 big buckets: pull, push, processes, and systems. Those were our big 4 domains. And then with each, there were a number of sub-constructs. Like within the pull domain, you had things like the characteristics and nature of the need, characteristics of the client's nature of the problem, demand, the benefits, things like that. So we had our constructs narrowed down, and then we would take those and use those in the building of our causal loop diagram. So that was the process that we did to bring together the list of constructs that we wanted to then build a causal loop diagram with. So our process, so Kate, she read a small sample of the full articles and started to build just an initial CLD based off of those few articles. And then I would continue reading articles, and we would pull out sort of these constructs and engage in that process of narrowing. We would incorporate, as we would iterate on the causal loop diagram, we would bring in non-repetitive constructs that we didn't already have mapped out. So sort of week to week, we would come together, make that list of, add to the list of constructs, candidate constructs, bring them into the model, and then start to map out any relationships that came from the literature or that came from our expertise or understanding, or even some of just our hypotheses of how they might be operating with each other. As we were doing this, we also wanted to balance parsimony and completeness, which I didn't feel like opposites in some ways, but there are just so many constructs that are involved in Scale Up because it's such a huge undertaking. So many could be populated in this framework, and which is helpful as well to just show everything that's out there. What we're hoping to do is see if there are highlighting the feedback among some general concepts. And so we were trying to strike this parsimony, but we also didn't want to leave out really important main constructs. So we were constantly going back and forth with, okay, is this accounted for by some other mechanism within our model? If so, then we'll drop it. But if not, we'll keep it. So I want to share with you some of our result, or some of our process, I should say. So here is like an early version of the CLD. And I'm just going to cut through these ones pretty quickly so you don't have to worry about making sense of them. And when we land, I'll show you the one where we're at now. But we started pretty simple. You'll notice that there's this sort of parking lot of constructs down here, and we would start to populate it. So we would build it out, add more in the parking lot, integrate them, build it out some more. It's getting more and more complex, adding more, seeing what we could bring in. Then we were like, okay, let's go from this to see if we can add some parsimony and really hone in on some feedback relationships. But then we realized that we had taken off some things that are really important. So we started adding them back in. And so I'll show you where we're at now. So this is the model, the causal loop diagram that we're using right now. I'm going to unfold it for you so you don't have to worry about making sense of it. We'll go sort of a loop at a time and then land on it again at the end. So just for those who are familiar, these are causal loop diagrams. We used Stella to create them. And here what you're seeing, and for those that might not have a background in causal loop diagrams as they're used in system dynamics, you have these variables with relationships and polarities that describe the movement throughout this cycle. So here, just to sort of read through this one, you've got the more urgent the need is, the more motivated a system is, a number of agencies are, to make a choice to adopt a practice that would meet that need. Similarly, the dissatisfaction with the status quo also increases that motivation to choose to adopt a practice that will address it. And the more agencies are making this mental choice, the more they will install that. And the more they install that, the more they're providing that, the more people, and you'll see our contact coverage show up here, are getting the service. And the more people that get the service in conjunction with the service being delivered effectively, and if there's a client or patient adherence piece that they're adhering to it, the more people will get well. And then the more people that get well, there's a delay here, but that will decrease the urgency of need, hopefully, over time. I think within the mental health services space, we haven't got to a place where the urgency of need has been decreased to see what happens, but we're hypothesizing that if the need goes down, that influences motivation and subsequent other agencies perhaps adopting things. So also building this out, there's an appetite for the system to do this. And as more people are getting better, those benefits are communicated more broadly in the scientific literature and the public health sort of health communications literature. As such, it increases motivation to continue to move through this process of choosing to take on these practices and then installing them. Also, when these benefits are disseminated, the stakeholders in the external environment, the political will increases. And those political actors and policy actors can then open up sources of external support, which feed into agencies, their capacity to implement the interventions. And if they have more capacity, their motivation goes up. What you'll also see here is if the intervention, the better fit it is, the more capacity the organization has to implement it. And the more complex the intervention or procedure might be, the more taxing it is on capacity. We'll come back to that. Organizational capacity also goes straight into implementation. So this is sort of getting things installed, but there's also this notion of keeping things going. So if you have a more urgent need, these agencies and system are more inclined to maintain it. And if they're more inclined to maintain it, more people are getting it. This could also go into contact coverage and work its way through. That also could be one way of modeling this. And similarly, as more people get better, from a client's level, they're going to perceive these benefits and communicate them more to people in their immediate surroundings. And the more people are viewing it as a helpful thing, the more that the system is encouraged to continue it. From an equity perspective, the more people ultimately of the target population that are being served, the closer we're getting to equity. As long as the more people that are being served, it's influenced by an equitable distribution of that target population. The more equity there is, the fewer health disparities there are. The fewer health disparities there are, the less dissatisfaction with the status quo there is. Similarly, the more equity there is, the fewer barriers to services there are, and the fewer barriers to service, the more contact coverage would increase. And looking over here with health disparities, the fewer health disparities there are, the fewer competing demands that these systems will be confronting, the more capacity that they will have, the more they're able to implement. So that's just a walk through the current draft of our causal loop diagram and thinking about how we went from a list of constructs to trying to map them out and showing these feedback loops. So this is the draft that we're at now. Would love to get any questions or thoughts or ideas that you have as far as what we're missing in our question and answer. But I just want to share a couple of sort of takeaways that we have from it. Some of our initial thoughts from it has been that just the exercise of incorporating scale up and their operational outcomes in a feedback perspective was something sort of novel for us to see. And some of those relationships jive really well with the literature, and we're just able to sort of map them out and offer a guess as to how they're functioning with each other and driving each other. The other thing that our work has pointed us to, on the list of potential variables that you could consider in scale up, we are attracted to this idea of stocks, things that can be, because really scale up in the end is the accumulation of something, accumulation of people served, of people who improve. And just like in a stock and flow sort of model, things can fill and things can deplete. There are leaks. And so that's what really our focus is moving towards, is looking at how we can accumulate and plug up holes. So ours, as we were talking about, striking that balance between parsimony and completeness. So we could have mapped out, I don't know, our spreadsheet is so long of constructs. But what we tried to do is sort of broader insights within each of those, like implementation is an entire field in of itself that could be spoken to, as well as notions of adoption. But we're trying to look at a consolidated way of simplifying that process. Systems always look at the, often we'll look at the goal gap structures. And so here it's not strange to see that we have gaps that are motivating actions and that actions are being constrained by context. Some additional takeaways just from some of the loops there, that health disparities undermine implementation in one way by creating competing demands for the system. That equity can fuel scale up by removing barriers to services for marginalized populations. And that really striving for equity isn't only the right thing to do from just like an ethics and moral perspective, but it's also a smart thing to do, that it can facilitate the end goals of reaching everyone who needs care and helping them to get well. So considering the urgency of need, competing demands, and dissatisfaction with the status quo, these three constructs are feeding into motivation, and why a number of organizations may choose to adopt or not an intervention. And then also, as you saw from our diagram, their capacity is the next thing. They might really want to do it, but maybe they're lacking the resources or capacity to do that. We haven't got here yet, but I guess technically scale up could be a double-edged sword, where if we fix the problem, the urgency of need goes down, which they can lower motivation or political will. It can sort of get forgotten. But we did build in those maintenance loops, as you saw. So it's an interesting then they'll probably be driving to a certain degree. Perhaps agencies will stop doing certain things, which could just be the nature of the system. But within mental health services, we haven't got there. And that dissemination, communication is key. Whether it's from patients or clients talking with their circle or the system talking to the broader communities, it's what can stimulate further support and motivation and capacity through resources. We're not the only people doing this work. Dr. Kurtz is also tackling this within the realm of physical activity, just highlighting some of the great work her team is doing here with Scale Up, taking the ExpandNet framework and trying to model this, bringing together a lot of those constructs and putting them in space with each other. This is where we're going next. This is a hybrid causal loop diagram and stock and flow, where we're translating the CLD into these stocks. And we're hoping that we can build this out and start doing simulations of this process to see how we can accumulate these outcomes of contact coverage, effective coverage, and equity within the relationships of these constructs. So that's what I have for you today. I'm excited to now turn my attention to the chat to see if there are any questions or comments. And if you don't have any questions, if you have any reactions, I would also be open to that. I've got my pen ready so I can start jotting notes so that we can make version 8 stronger as we're trying to put this together. But anyway, thank you all so much for your attention.
Thank you so much, Dr. Hooley. That was really great, and it's really wonderful to review these different studies that have already been produced on identifying how to really map out scale up. And it's amazing to see where your research is going. to lead on a question or some points. I know that we already have a question from Alex Morshad. I have a question myself, but Dr. Hong, you can start.
All right. I'll get us started. Thank you so much, Cole. That was great. Can you, Cole, pull up that CLD again? I think that people probably didn't get a chance to really process all the different aspects of this diagram. I guess my question for you and really for the broader audience is kind of thinking about how the different loops compete with each other, at different times and maybe in different contexts. And particularly, two things. One is, when we see this all the time in public health, when the urgency of the need decreases, resources get shifted to something else. And so ensuring that the reduced perceived need, doesn't lead to lower adoption of programs or this is occurring scale up as you define it. Some of these other reinforcing loops, for example, on the to the side of that need loop, balancing loop, may need to be kicked up the notch in order to actually sustain and keep the program going. So that's the first question. Yeah, and then the other question, I guess, is I think that oftentimes, we see that what makes a program or intervention effective is not necessarily what makes scale up possible.
Yes.
So as programs and intervention shift into different phases, in practical terms, even if we're talking about some of the same constructs as shown in the CLD, the actual meaning, the actual substance of what would go into those constructs may actually be different. So if you could also speak to that a little bit.
Yeah, of course. Excellent questions, Terry. I really appreciate it. So one thing that isn't on this model, but is speaking to your notion of sustainment, is we do have, what we do have is this notion that like when the things collide. So you might have an urgency of need go down, which could decrease motivation. But then you could also have people really liking it, which would increase the appetite for people coming in and asking for it, which would keep people wanting the maintenance of something. So those two can collide together. And in our simulation, as we are sort of sketching it out, we can then be able to sort of dial up and quantify, well, how much, if we're able to say things like we see this in psychotropic medications, for example, with a certain number, certain percentage of people who end up getting treatment that have, by some markers, no need of it, but their appetite for it pushes the system to provide them a service, even though some might argue that they didn't need that particular service from the get-go. So there is probably something from the consumer side that if it could be stronger, even if there's not, which is a separate thing I'll say, is here to external support. Speaking of sort of the entrepreneurial lens, organizations, many organizations have to pivot to go where the money flows. And so if there are certain, like you said, Terry, there are certain times where something will go out of vogue in a way. And so certain startup grants, block grants that many of nonprofits and community-based programs use get dried up, and then they have to go after something else or tag it on. But if you have something else that can feed external support in the guise of funding, for example, then there would be less of a reliance on these other portions of the model because you have an inflow of resources. So that entrepreneurial thing comes in with the fit. So if it's really a good fit and that you have a system that will keep it solvent, that people will want to buy it such that it could float these programs through. So that's one response to your first question, and feel free to prompt me if it didn't tap what you were getting at. And then your second had this notion of what can lead to an effective intervention might not be conducive to an effective scale up. So true, so true. A lot of that we're couching here, where so often people will spend entire decades refining and tweaking an intervention to make sure its effect size is potent enough. And then once it hits real life, things dry up, shrivel up, or the context has shifted since it was developed to the point where there's not a fit anymore. I feel like we're in this moment of flux right now where we had such an exogenous shock to our thinking about what's possible with service delivery, at least in mental health services with COVID, that I think some programs that required in-person visits, for example, have been flipped. So you're right. I do think that some of these things will need the inner part of what these constructs are could shift over time as far as what is most important. But broadly speaking, this, other than feeling like the package, as some of your earlier presentations have spoke to about user-centered design principles, like that sort of notion gets parked here, saying, well, you have to start there, because if the intervention is not just conducive to working as far as getting a good outcome, but is good for working in the system, then we view that as improving and not hindering capacity. So those are two thoughts, but happy for follow-up questions on those, Terry, or questions from other people. Should I be looking at the chat and answering them, or is someone going to feed them to me?
We'll feed them to
Okay,
you directly. Yeah, thank you so much. Terry, did you want to add to that?
No, I think that's so great. I mean, I think just, with everything that you're saying, Cole, kind of speaks to the need to be mindful of all the different moving parts, of this complex system simultaneously, right? Because oftentimes in research and public health, we may be focusing on like the inner loop, but then we're forgetting about some of these outer loops. But if we're not doing that, by the time that we're done, with the first 5 years of the grant, we haven't built up any support to actually even begin, the scale up process. So I think that sort of the need to kind of be more comprehensive and also being mindful of, kind of this simultaneity or close sequencing, of the activities that we need to engage in with an eye towards future scale up, I think is so important. Anyway, Alessandro, I'm going to let you pull in some of the other questions.
Yeah, definitely. Thank you so much for the question and for that answer. I was wondering, Alex Morshid's question goes into your point that you're mentioning right now, thinking about how you're actually going to use this kind of work, 5 years down into the grant, and how this is actually going to translate. And also this also makes me think about what brought you to do this specific type of study, and particularly within mental health. And if you have any sorts of partners or stakeholders engaged with this type of work that is looking to utilize it in some fashion.
Yeah. So Alex, first of all, hello. So good to see you or see you. And like this, your question is so spot on, because so for us, if we're thinking about this, like the CLD is like the qualitative part of a systems sort of simulation. And so like in good qualitative work, we want to do member checking to make sure that what we have here is proximal to reality, or that we haven't missed something that's like, you totally missed something that influences us in a significant way. And so some of the thinking that we've had as far as tapping into people engaged in this work. So specifically in my space of mental health services, there are there's two kind of groups that I'm interested in particular. One is easier to access, unfortunately, are researchers that have been funded by different national institutes specific to scale up projects, and reaching out to them and hopefully bringing them together and getting their reactions to the model in a sort of like group model building way, where we're providing them with a seed structure and then saying, if we unfold this to you, what are we missing? And so that was kind of one hope. But the other thing that's more elusive to me that I am struggling to know is that piece about policymakers and also larger system. So here in Utah, for example, it's a county-based system. And so one hope is to reach out to the county-based administrators to see if they would be willing to engage in a similar sort of group model building exercise. But policymakers, that's been trickier for me to know how to get some of their time and attention. I know there have been efforts to do surveying to sort of get at their attitudes towards some policy things, but I don't know how to get enough of their flexible attention to talk about this. So not great answers, but you had a great question.
Thank you so much for that. And what we were wondering, Lisa had a question as well, was wondering about the time frame of approaching this type of work, and going back to your own experience, going back to literature out in the field, and also considering how the field is changing currently, and especially over the past year. It's interesting to think about starting from day one, how long it takes to be able to get to this point, and thinking about the other CLDs that you showed us. Is like that are complete basically, how long those may take as well.
Yeah. So some milestones in our project. We did the literature search last summer. So if that's one time marker you've seen, it's like less than a year from when we did the search. But as far as the construction of the CLD, it's been the last few months. So I think since January is when we've been in earnest, meeting often weekly, but then sometimes every other week since January, kind of bringing that together. So less than a year, but that also benefited from some previous work that I had done. So that's kind of unquantifiable, but that's kind of the range that we're looking at to get to what version 7 that you're seeing right now.
And for the future, in terms of what your upcoming milestones are with this publication.
Yeah, so then our next milestones are, we're trying to model out the simulation part to see if we can get that working. And then like Alex pointed out, starting to building out these member checking opportunities to ensure that what we've got makes sense and that we're not missing anything, no glaring gaps. There's also, because of the hermeneutic approach, there's the opportunity to make sure we're going back and seeing. So there's another framework or two that we want to make sure that we've captured everything. So there's a little bit of that iterative still to do.
Gotcha. Well, thank you so much, Dr. Hooley. Really appreciate it. And if anybody else had any questions, feel free to jump in the last moment here. We actually do have one more question from Carolyn Sheehan. Thinking ahead to when you build your stock and flows and simulations,
yes.
Any thoughts about how you'll quantify some of these variables, or how you'll gather evidence to quantify stocks and flows?
Yes, that's such a great question, Caroline. So we have, we've kind of thought through a couple of different ways. One is purely synthetic, just like a proof of concept sort of notion, where we can look at these different constructs and look at proximal ways of measuring them, and then creating sort of Monte Carlo-like fake data, just to see that we're getting the simulation to run, just that it works. But then getting data that approximates reality, that one we still have some question marks on. We're not quite sure, especially with mental health services. There are some others that health conditions that contact coverage and effective coverage are even possible. This shows like a huge gap in our health services infrastructure that we can't even answer some of those questions. But the synthetic data is one of our proximal reaches that we're going to try.
Great, thank you so much for that. And there's some extra points coming in here from Dr. Huang mentioning that we do have a systems dynamics modeling course at the School of Public Health that you can definitely get more information about. If you'd like to get more information about that, you can reach out to us at cscd@sph.cuny.edu. Lisa, can you add that to the chat? That'd be really helpful. Again, the cscd at sph.cuny.edu. You can get more information from us about these types of courses as well. And thank you all again for joining us. Thank you so much, Dr. Hooley, for joining us for our next session of the Systems Change Lecture Series. And we're very much looking forward to sharing this recording with our registrants and the slides as well. And yeah, if anybody would like to follow Dr. Hooley, he's on LinkedIn and he's also on Twitter. We put it into the chat so you can check it out in there. And please, Dr. Huang, if you would like to.
No, just a big thank you to Cole. I know that we've been planning this for some time, so I'm really thrilled that we've finally been able to do it. This is really great. I can't wait to read your upcoming papers. So I know that we'll stay in touch, and all of this is channeling towards something. So we're gonna be collaborating for sure in the coming year. So thank you to the audience for joining us today. It's a great beginning of summer day here in New York, and I wish everyone a wonderful summer, hopefully more joyous than last summer. And stay tuned. We're going to continue our lecture series in September. We usually do somewhere between 6 to 8, such lectures throughout the academic year. So definitely stay connected with us. Follow us on social media, LinkedIn, Twitter, and whatnot. And let us know if you have any new ideas for things that you would like to see featured as part of our series. And check out our Firefly Innovations website, see what we're up to on all the different hackathons, accelerator programs. And again, let us know how you want to get involved. So thank you all so much and have a wonderful summer. Thank you, Cole.
Thank you all.
Bye.
Bye all. Thank you so much for joining.